So yesterday we presented a discussion of 3 oral abstracts that were part of the biomarkers in the early stage setting in breast cancer. There were 3 abstracts, and they related to an exploratory analysis of the NeoPACT trial, which was done out of University of Kansas Medical Center, or Kansas University Medical Center rather, that looked at a shortened chemotherapy in early stage triple-negative breast cancer with the addition of Pembrolizumab. So it was carboplatin and Taxol for 6 cycles with Pembrolizumab. So this is a significantly shortened regimen versus the Keynote 522, which is now in standard of care clinical practice. This was an exploratory analysis of RNA sequencing gene expression signatures in patients looking for potential biomarkers of response to chemoimmunotherapy benefit. The second abstract was a meta-analysis of the prognostic and potentially predictive value of TILs in the early stage HER2 setting. So the idea was that the FinHer study had shown that there was a predictive benefit of Trastuzumab benefit, there was a predictive utility of TILs in patients that had received Trastuzumab. What this study actually found was it was unable to confirm the FinHer results, and instead found that high TILs were generally prognostic in HER2 positive patients, but they retained Trastuzumab benefit regardless of their TILs level. So it was a very confirmatory but very definitive study. The final abstract was the FHERGain trial. So this was updates from the FHERGain trial, which looked at the use of the imaging biomarker PET early on in therapy to help reduce the amount of chemotherapy that patients receive within this setting. So the really interesting finding from this abstract was that about 30% of patients could, in the early stage HER2 positive setting, could be spared from chemotherapy by looking at an early PET scan to determine whether or not they had a response, and then furthermore looking at whether they had a pathological complete response or residual disease. If they had residual disease, they would go on to the chemotherapy. If they had a pathological complete response, they never received chemotherapy. And actually these patients had a really, really outstanding outcome. There was only 1 event in the entire group, and it was a local recurrence. So there are some questions still around that because it was a phase 2 non-comparative trial, but potentially practice-changing ideologies and results.